Tonight we're starting out with a report focusing on mental health, specifically conditions at Oregon's mental health hospital in Salem. It's nearly always full, and the hope is that patients are getting great care and that they're safe. But a new report reveals that's not always the case, and that is our big story tonight. A 102-page report by federal investigators from the Centers for Medicare and Medicaid Services shows a pattern of violence and sexual assault among patients there. It also notes staff members failed to intervene. The report stated that violence between patients was so bad that some would end up in the emergency room. And investigators found no plan in place to keep incidents from happening again. There were also sexual assaults that happened at the hospital, and investigators found that staff members were handing out condoms to patients even though sexual contact is not allowed there. Investigators made an unannounced visit to the hospital's main campus in Salem that lasted about 2 weeks, from February 28th and March 14th of this year. They also checked out patients at the facility at Junction City. What they found was pretty damning. Systemic failures that represent a limited capacity on the part of the hospital to provide safe and adequate care, and that the governing body failed to ensure the provision of safe and appropriate care to patients in the hospital. They detailed a couple of incidents in that report. One was an attack on a patient by another patient back in February. A person they called patient 23 was sitting in a courtyard one day when another person, patient 22, came up behind them, put them into a chokehold, lifted them up and shook them until they lost consciousness, and then tossed them into a corner. Staff members did not see it happen, and the victim was found by another patient. The report also says the staff knew that patient 22 should be in a secluded area and away from other patients. That patient had made threats toward staff and inappropriately touched one of them. 3 days before, that patient had made statements that they were homicidal and said, "I feel like killing someone again," grab someone around the neck and strangle the F out of them. Another incident details a patient who reported having sex in the hospital sensory room. A patient reported being coerced into sex, and the hospital found that the patient and that person was unable to give consent because of their mental state. When staff members went to the room, they found an open condom wrapper. Investigators found that staff members had been handing out condoms, which confused the patients. The staff reportedly said the condoms were for self-care. A reporter asked Governor Tina Kotek about that last week, just hours after the federal report became public.
I don't know why they're handing out condoms. That was news to me. We're going to ask them why that's happening. And we have been focused on improving the outcomes for individuals at the state hospital. As you know, it's mostly a population of folks who have been connected with the criminal justice system as aid and assist and getting ready for their own defense. My primary concern is making sure what we're doing there is evidence-based. We're supporting the workforce to do it, and we're going to continue to monitor. But that particular little fun footnote was a surprise, and we'll be talking to them.
The report noted that the hospital has more than 1,000 cameras throughout the facility, but not enough people to monitor all of them, and that the cameras have blind spots. They also found that staff members were not properly securing hospital doors or being aware of what was going on with patients. All in all, they found that the hospital failed to ensure each patient's right to provision of care in a safe setting, the right to freedom from all forms of abuse and neglect, and the right to prompt and appropriate response to grievances. Those failures resulted in actual and potential physical and psychological harm to patients. For their part, the Oregon State Hospital says there are always things that they can improve, but they are dedicated to the patients. Their deadline to come up with a plan for improvement is today. After that, the plan will need to be approved by the Centers for Medicare and Medicaid Services, who will inspect them again to make sure the improvements are actually happening.